And yeah, Noni, it's only 9 years old, and he has this genetic heart problem, and he will have difficulty in breathing. And it is a very complicated condition, genetic condition. And yes, this video will be shared in all our Telegram groups, so everyone can watch the story of our Bodhisattva physicians. And this young boy, actually, later on, yeah, he received all the medical attention and services and treatment. And this is really truly a very good cause and condition. And besides the Philippines, let's see where else did Dr. Zhang goes to help the poor and the needy. And this is in a rural township at Taipei. And he has been doing the home visits, the home care visits. And we're very grateful to our doctors and nurses are taking good care of the elderly. The elderly granny was asking the Dr. Zhang if she drink coffee, will she be able to sleep? And Dr. Zhang said, advise her not to drink at night, but she can drink it in the daytime. So it is a very caring and very friendly interaction with the patients, with our elderly. And yeah, it's a very cute encounter with this lovely granny. And during the vaccination process for the public, and so our Dr. Zhang went to the site, the vaccination centers, to supervise and to ensure that the public and the healthcare professionals, they are all properly equipped and prepared, and to control the crowd properly. And then Dr. Zhang gave his advice and guidance. So through all this advice, expertise advice, they're able to carry out the process smoothly. Okay, so the next video clip, you can see that we have in Tzu Chi, we have many big and small events. So Dr. Zhang will be sharing with us how he became a cardiologist. He's a cardiologist. He turned into a Tzu Chi volunteer. So, yes, we are very grateful to Dr. Zhang because he's always very busy. And we have been inviting him for a long time. But because on every Wednesday, his schedule is full. Yes, so Dr. Zhang and yes, and finally we are able to get a time slot from him and to share with us today. So we are truly grateful, and it's really a rare opportunity for us to hear from Dr. Zhang. I like to be with you because you have positive energy. Let us welcome Dr. Zhang. So grateful to you. Thank you. Thank you, Teacher Meiyin and our Kaohsiung team. Good morning to everybody. Please share with us your slide. Firstly, I'm grateful to Kaohsiung Online Book Study for your invitation. I'm proud to be invited today, honored. And I want to share with everyone from a cardiologist to a city volunteer, why is that so? And our dear master and Albert Masters and our Thailand CEO and Cambodia CEO and our Tzu family members from all over the world. And wishing everyone good health. And I'm from the Taipei Tzu Hospital, Dr. Zhang Hengjia from the Department of Cardiology. Firstly, yes, this is my first time to share in Kaohsiung book study. Let me give a self-introduction. I was born in 1960. My Dharma name is Jixing, given to Master back in 2006. And seeing in Chinese, this character, it has got a heart and a health, which means if you put them together, it means cardiologist. And the heart and life add together is the cardiologist duties to protect the heart and save lives. And after 5 years of training, from 1990, I became a cardiologist, and I've been practicing for 32 years. Currently, I'm serving at the Taipei Tzu Hospital. I'm wondering, does everyone have any fishing experience? Because my very first encounter of fishing actually influenced me to become a cardiologist in the future. You know, when I was small and there were, in Taiwan, there are many fishing ponds. So there'll be many people, they'll be fishing at the ponds. And one time when I was in primary 1 or 2, and it was my first time to go fishing. And the first fish that I caught, I was very nervous. And I have this deep impact. There is a small fish, but when I reeled it up and saw the fish jumping on the ground, and I was very nervous, and I removed the fish hook. And I remember at that time, I had this worry or thinking that the fear of death, by the fish. And this fish was struggling, gasping for air, and this fish is going to die. And this worry at that time, and the fish was jumping, and it jumped off from my hand and landed back into the pond. And at that time, I feel a sense of happiness because I'm thinking that the fish is now free. It's free from danger, and I felt happy. And now both the fish and I were freed. Actually, the first time that I fished, that was the very last time that I went fishing because I made a vow not to go fishing again because it's not the right thing to do. And okay, now you can see the chart. And okay, yes, sorry for the interruption. Okay, now we look at this chart. The ECG tracing shows that the DC shock could save a patient's life. And when I was in a school of medicine to be trained, to be a doctor that could save life is really a noble profession. And 12 years ago, in 2008, a 42-year-old man, and suddenly he died suddenly in the early morning of due to the cold winter. And you can see that from these photographs, in black and white photograph, you can see that the the signs of the shock, the DC shock, because we delivered 13 times of defibrillations, and we tried to revive him because he suffered from the myocardial infarction and had a sudden death. So at that moment, we decided to send him to the cardiac catheterization room to quickly open up the blocked coronary blood vessels. And his wife was notified. She was holding a 4-year-old child, and she was in a panic. And we managed to save this patient's life. And until today, even their child is now in high school. It has been 12 years, and there was no recurrence of the myocardial infarction, nor any side effects of the brain injury. And you can see from this image that the blood vessels were constricted, were blocked. So after stenting, we put in the stent, so it allows the blood to flow, to pass through the coronary blood vessels. So this type of surgery is now getting very common. And for the past 32 years, we have hosted many conferences and given academic speeches at the International Society of Cardiology. And this is a patient of an American who came to Taiwan on a business trip. And he lived in New York. And at the time when he was in Taiwan, at the airport, Taiwan, at the airport, he had a sudden heart attack. And he was admitted to our hospital. And after treatment for acute myocardial infections, he was discharged stably and returned to the United States. He then sent me a thank you card. And when he was back in New York, he went to the Mount Sinai Hospital, a very famous hospital for cardiology. And he found out from the doctors at Mount Sinai that all the procedures that he received in Taiwan were properly done and followed accordingly. And his life was saved. And to me, a cardiologist profile is like a Captain America. So I think this is not too bad for me if I could be Captain America. Actually, what's the difference for Captain America? You can see that these heroes, before any disaster happened, you won't see these heroes. And when the disaster is over, they disappeared. Whether it's Captain America or the Avengers, the heroes, and you only see them when there's disasters. This was in 1997. At that time, I thought I was a very successful cardiologist, and I had a caricature cartoon drawn for me. And yes, the patients will only see me during the surgery. Before and after, they will not be able to see me. And you can see this cartoon drawn was me. And that was in LA, in Anaheim, Disneyland. and I paid $10 for this caricature. And the artist asked, where are you from? I said, I'm from Taiwan. And what do you do? Oh, I'm a cardiologist. And you can see that is my name, Dr. H. Zhang. Back in 1997. And to a cartoonist, an artist, his impression of a cardiologist is like this. And and the image that he has is that doctors and surgeons, they are all, for making money, and they are successful because and they have lots of money because they charge a lot, and it's all about money. And so I decided to keep this cartoon with me as a reminder, to remind myself that that I should not be just be a doctor just for the sake of earning money. So people will ask me, why did I change from a successful cardiologist to become a Tzu Chi volunteer? And in my experience of and encounters with many Tzu Chi commissioners, they would share with me about Master Cheng Yen and what Tzu Chi has been doing. And at that time, before I joined Tzu Chi, my understanding of Buddhism, it's only about meditation. And this the karmic conditions are really wondrous and incredible. And there was this article and about the impermanence of life. Master talk about the sudden death because impermanence, it could happen anytime to anyone at any age. That was this article was published back in 1998. That is teaching us to expand our heart and to observe life and death. And when I came into Tzu Chi, then I realized that what Master has been doing, and this is the humanistic Buddhism for working for Buddhism and for all living beings, and everyone has Buddha nature. And looking at this slide, this cartoon, you see that when the dish plate is open up, actually it's empty, it's nothing. That was because there are so many things that I have not done. It's empty. And I have no experience in conducting free clinics in remote township, international disaster relief, and whole person healthcare. I was 45 years old, but I have no experience in all of this. And so I started to join Tzu Chi to visit all these patients in their homes because they are unable to come out to seek help. So we have to go in to reach out to them. And actually, these are all my teachers. and it allows me to do a self-reflections of what I want to do in future. And when we go for home visits or free clinics, uh, you can see that there are some of the patients living in very poor conditions without water, without electricity. And you can see that the patients, they have wounds all over their body, on the head, on the legs. And you can see the pus. Yes, there's not even a proper place to clean his wound or change his dressing. And Master taught us that it's not enough just to be sympathized, to have sympathy of others, but we need to go among the people and give selflessly. And this is another elderly patients couple, and they have nothing at home. And some of the furniture are already broken, and they couldn't throw them away because they could not afford any new furniture. And from interacting with all these patients, it allowed me to realize the deeper meaning of gratitude, love, and respect. Okay, this is about the Philippines Typhoon Haiyan that caused a major devastation in the Philippines back in 2013. And you can see that the victims, the survivors of the typhoon, lining the streets, and they were looking very helpless, very hopeless. And we could see that one of them carrying posters that says, "Please help us, we need food." And you can see that the whole township was completely destroyed. And it's like a death town because there's no life. Everything is totally damaged. And we could see that there were soldiers standing guard to keep order. And we were there. And it totally changed me because I could see Master's wisdom and Dharma in carrying out the Cash for Work program. And from this Cash for Work program, it allows the villagers, the residents to come and clean up their own living environment, the whole town, and being paid for it. So at the beginning, these people were hopeless and they have given up hope. But through our Tzu Chi medical missions and the Cash for Work program, it have given them new hope. And this is this elderly patient was telling us that only today they found the body of her son among the debris. And at that time, I was really thinking of how I can help her, to do my very best to help her. So from all these disaster sites and encounters, it really taught us a lot to be grateful. And you can see that our superintendent, he is so humble and he bowed 90 degrees when giving out the aids. And you can see from these pictures, even though the town still has a lot of garbage on the streets, but the kids are all starting to be cheerful. And next, this is my sharing on the Nepal earthquake disaster back in 2015 in Timi, Nepal. We were the earlier teams that set foot there. We went there to survey the sites so that we can prepare for the free clinic visit. And the locals was telling me that among the debris, the ruins, there were still bodies. There are still people. There's bodies being trapped in the debris. And during the medical mission, the free medical mission, usually the situation would be very chaotic. Would there be any danger, any risk? Would there be soldiers, policemen to keep an order? So when we were on that day, when we arrived at the site, okay, I was in the first car that arrived, and then we set up the tentage, and arranged the medical supplies. And a few of the nurses and pharmacists that were with me, and they were telling me that they could go, and since we have the medical mission has not started, they still have time. They could go and visit some of the ruins. So at that time, I was the only one left, and the people there they were starting to get agitated, but I couldn't understand what they're talking in Nepalese. So the situation started to become chaotic, because maybe they were thinking that we are going to leave, because they see that some of our volunteers had left. So and suddenly there were two locals, and they came out, and when I saw that, I asked them, "Can you speak in English?" And they said yes. They could help me to translate. And so I asked them to help me to explain to the locals that we will have more people coming, and just give us some time, and we'll have another group team that's coming in to provide the medical missions. And we need to register everyone, because we have to keep track of the patients to just in case there's any outbreak of disease. Then we can have a contact tracing, and we know who are the people that has been here. And yes, and we need to take down all the records and report back to the Ministry of Health of the Nepal government. And so these two local volunteers, they were very helpful. So they helped me to translate and inform the locals. So very quickly, all the locals were back in an orderly manner. And you can see these two gentlemen in the red box. They were very helpful. And you can see that these are the locals. And they were very grateful and wanted to take photos together with me. So, okay, so in closing, I have two conclusions. First, why do I become a Tzu Chi volunteers? It's because when I'm doing all the home visits in the poor townships, it actually allows me to see and realize and practice the Buddhism, and maybe realize the true meaning, the true wisdom of the Tathagata, of the Buddha. And during the Taipei COVID-19 outbreak, so we have taken care of many patients that were infected. Okay, in closing, the question of why do I become a Tzu Chi volunteer as a cardiologist? And actually, it's because I wish to understand the true meaning of the Buddha and master's vows of striving for Buddhism and for all sentient beings. And being able to give is our blessings. And we are grateful to Master Cheng Yen for creating the Tzu Chi world for us to be able to give, to become a better person, not to become a wealthier, a richer person, but rather to be a more blessed and complete person. And I'm very grateful to be able to walk on the Tzu Chi path, life after life, and grateful to Master Cheng Yen and to the Tzu Chi world. Thank you to our Dr. Zhang. Actually, he's very kind, and you notice that his PPT slides, it has both Chinese and English. And initially, his slides were all in English, so some of us couldn't understand the English. So Dr. Chang was asking me, do I need to speak in English? and actually, no, we told him that just give us both Chinese and English, because some of the medical terms require a lot of translations, technical terms. And so Dr. Chang was very kind. He gave us both the English and Chinese version of his slides to make it easier and convenient for us to translate. And some comments from our volunteers from Thailand, and commenting about Dr. Chang to helping to save lives and safeguarding the health of many and the poor. And
非常感恩哇，非常感恩张
父。we have
他真的非常的贴心。你有没有发现他的简报
we have comments from Beijing that Dr. Chang is actually a spiritual cultivator, a doctor with spiritual cultivation. And there's also comments about how Dr. Chang saves the heart and lives of many people. And from the Northern California, Sister Linda Peng. And another comment that we in Thai TV we could see images of how our doctors, they even go to the recycling, the eco stations to do recycling. And another comment that Dr. Chang is like the laughing Buddha, the Maitreya Buddha, who is also always smiling, very compassionately. And we have so many responses and positive comments. And I hope Teacher May says that when you rewatch again this segment, you could really observe, the manifestations of wisdom and compassion, in Dr. Zhang. How he became a Tzu Chi volunteer from a cardiologist. So very soon he has to go back to take care of his patients. Let's give a round of applause to Dr. Zhang We're grateful to him. It is so wonderful. Okay, let's come back to my slide. Now, these written feedbacks, commentaries, it's about our sister, our two sisters sharing, which was very touching and very inspiring, that allow us to keep moving forward, overcoming the obstacles. And the story of the principal that was helping the locals students. And yes, our volunteer from Chongqing, mainland China, commented that with the aging populations, there are more and more elderlies, especially in the cities. And like 20 to 30% of the populations are becoming elderlies. So if our elderlies can be well taken care of, they could actually live a healthy, active life and still could contribute back to society. And now is the time in our society where the young and the old, the young and the elderly should have more interactions with each other.